Okay, thanks for everybody. Good evening. And thanks for Dr. Yasser for his comprehensive review for the child abuse. We will continue in preventing the diseases. So my talk will be about the prevention of human papilloma virus associated diseases. Okay, I will jump for the sake of time directly to the human papilloma virus. So just simple review for the human papilloma virus. It is a virus which infects the skin and the mucosa. And the trouble with this virus that it can be transmitted by touching. So it is maybe more easier to be transmitted between humans than the coronavirus. If someone touched the surface and that his hands were containing human papilloma virus, this virus can be transmitted to anyone who is touching that surface. The trouble with the human papilloma virus that it is classified as carcinogenic. And there are more than 200 different strains identified. Now, to give you an idea about these strains, there are more than 40 strains infecting the mucosal areas in the humans, and more than 80 strains are continuous strains. Now, our concern in this talk is the mucosal strains. The mucosal strains, some of them are high risk because they are oncogenic. And these strains are 16, 18, 31, 33, 45, 52, and 58. I think by the end of the presentation, you will memorize these numbers because these are the culprit for the cervical cancer. And these strains, not only they can cause cervical cancer, also they are the cause for oropharyngeal cancer, anal cancers, and precancerous lesions. And we have two strains, 6 and 11, also you will remember them, because they are the causes, they are causing genital warts and the different types of laryngeal papilloma. Now, to just have an idea how much the burden of the human papilloma virus, these statistics are from America. They are having around 13 million persons infected annually by human papilloma virus. And for humans in general, the lifetime risk is more than 80%. So 80% of all over the population on Earth can be infected in their lifetime from human papilloma virus because it is easily transmitted. So it's as we said that it is very easily transmitted, so nearly everybody will be infected, and the trouble that it is a lifelong infection. Human papilloma virus is similar to EBV, CMV, and herpes virus. Once the virus gets in the body, the virus will not go out. Now, the statistics from America are around 80 million infected humans, and as we said, 14 million per year, and from those, 44,000 develop cancers related to the human papilloma virus. So just imagine the number that 44,000, this can give us an idea how much the impact of the human papilloma virus infections. Now, also to imagine how much the impact, if we compare the deaths from human papilloma virus to the deaths from measles before the measles vaccine was introduced, the deaths from human papilloma virus are more. So if we are in a time that we want to choose between developing a vaccine for human papilloma virus or vaccine for measles, I think from cost effectiveness and from prevention point of view, developing a vaccine for human papilloma virus is more valuable than measles. Luckily, we have both now. As we said that once the virus is in, the virus will stay in, and it will not go out, and it will be activated later in life. So to just have an idea how much it's affecting males and females, 65% of those cancers are in females and 35% are in males. And the cervical cancer related deaths in America, they were recorded by 2020 that more than 4,000 females died from it in each year. So this can give us how much the cancers that are related to human papilloma virus are affecting the health all over the world. So the solution is the vaccine. There are available vaccines for human papilloma virus nowadays, and I will touch about them and their efficacy and their impact. The human papillomavirus vaccines, they are safe, well tolerated, okay, and we will see now they can prevent most of the cases that are related to human papillomavirus cancers. We know that cervical cancer now is having a screening program, and this screening program is implemented nearly in most of the countries. One of the countries is UAE. We are having cervical cancer screening program, but the idea the cervical cancer screening program will not detect all the cancers and will not prevent all of them. But if we are managing patients by giving the vaccine, nearly we can prevent most of the cancers. The other thing, if a female was diagnosed with cervical cancer and operation done to get rid of that cancer, there will be a complication or complications. One of them is infertility, because some cancers, the only way to cure the female is to do hysterectomy. And the other surgeries which currently used, they are having some sort of morbidities. Okay. Now, even if we saved the uterus and that lady still can be pregnant, this pregnancy can be complicated by perinatal mortality.
One more time. Let's refresh your browsers. Like, send me a photo of your screen.
Walid, I can hear you. I don't know if the audience can hear you also. Okay, now let's go back to the slide. So if we manage to treat the female by saving the uterus, and this female will get pregnant in the future, now in the future, this pregnancy will end up by high risk of complications like perinatal mortality, preterm delivery, and low birth weight. So yes, the cervical screening program is very effective. It prevented many cases of cervical cancer or advanced cases of cervical cancer, detected early cases of cervical cancer, saved the life of many females, but still we are not reaching the optimum prevention. So how about using the human papillomavirus vaccine for boys? Now, the human papillomavirus is not the culprit only for the cervical cancer and the anogenital cancer. It's also the culprit for oropharyngeal cancers. And in the previous slides, we were discussing that the cervical cancer is having a screening, but the oropharyngeal cancers are not having screening programs. In addition to that, the human papillomavirus is also the culprit in causing anal and penile cancers in males. I think this slide can give you a hint how much human papillomavirus is causing cancers in humans. Now, if you can start from the left side, or to give you an idea what the graph is talking about, this graph is talking about the percentage of cancers related to the human papillomavirus. So from all the the percentage of cancer related, yes, to the human papillomavirus. So from all the cancers in the cervix, 91% of these cancers are caused by human papillomavirus. 75% of vaginal cancers are related to the human papillomavirus, and so on. So if you look at the cancers in females, cervix, vagina, vulva, anus in females, and oropharynx in females, these are the numbers, and you can see the least is 63%, and it can reach up to 91%. In the right side of the graph, it can show that in females, 83% of cancers in these areas are related to the human papillomavirus. Now, in males, the penile cancers, 63% related to the virus. Okay, the anus, 89%, and the oropharynx, 72%. So also in males in these areas, 74% of the cancers are related to the human papillomavirus. This is an old research, but it can give the idea. It was concluded by 2004. It can show how much increase in the oropharyngeal cancers related to the human papillomavirus. You can see the red lines going up. This is the oropharyngeal cancers caused by the human papillomavirus. Now, these statistics also from America, they are having 11,000 cases of oropharyngeal cancers, and 7,000 of them are in males. And the expectation, the projection of the studies that these oropharyngeal cancers will cause mortality more than the cervical cancer by 2020. Now, let's go to the recommendation. The American Academy of Pediatric and the infection control recommendation is that to give the human papillomavirus vaccine to the pediatric population starting from the age of 9 through the age of 26. If we are vaccinating between 9 and 14, we are giving 2 doses. And if we are vaccinating above the age of 15 years, we are giving 3 doses. The 2 doses will be 0, 6, or 12. That means 0 or, and after 6 months. You can give it at 6 months, 7, 8, okay, maybe 1 year. And if the patient is coming later, also you can give the booster dose. Now, if the patient is more than 15 years of age, we need 3 doses. 0, 1 to 2, and 6 months. It is similar to the hepatitis B virus protocol. So why we are giving only 2 doses in the age younger than 15 and 3 doses in the age above 15? Because they noticed that the antibody response is more in the younger age than the age between 16 and 26. Until now, the studies, they reached 8 years, and some of the studies are more than 8 years, and all of them confirming that the antibodies are persisting. So if any patient or any child was vaccinated, the antibodies will stay protective more than 8 years. And the recent studies are talking about more than 8 years. This is the same. Now, what are the available human papillomavirus vaccines? Human papillomavirus vaccine is available in UAE since 2008. And in 2018, it was introduced in the schools, and it is offered to the females in the schools from the age of 12. So it is available. It's available in most of the hospitals. We are providing it in our hospital. And we are having, I will show you in the next slide, yes, the brands. Now, the brands, I think I told you at the start, you will memorize the numbers by the end of this presentation. The first one was bivalent. Bivalent, it was targeting the strains 16 and 18 because most of the cases of cervical cancer were related to 16 and 18. Then quadrivalent added to it 6 and 11. If you remember, 6 and 11, those are talking about warts. So then the 9-valent, which is the currently available, they added the other strains which cause cervical cancer, 31, 33, 45, 52, and 58. So the 16 and 18, if you notice, are included in all the vaccines. The 16 and 18 are the main strains which are causing the cervical cancer. If you go to the bottom of the table, you can see that when the 16 and 18 or the bivalent Cervarix was introduced, it was mainly for females. But since the quadrivalent was introduced, they start vaccinating also males because this will prevent warts. At the same time, it will decrease the incidence of oropharyngeal cancers. So if you are having in your hospital or in your facility the quadrivalent or the 9-valent, you can vaccinate both males and females. Now, how much reduction in the cancers related to the human papillomavirus after the introduction of these vaccines? We will give you some of the research from United States. When they started with the 16 and 18, there was a 62% reduction in the human papillomavirus associated cancer, and also 50% reduction in the cervical intraepithelial neoplasia. Now, 16 and 11, as we said, they are related to the warts, and they were more effective after introducing these strains in the vaccines. There was 90% reduction in the warts. Then in the 9-valent, they added the 31, 33, 45, 52, 58, and we said before these are related to the other causes of cervical cancer. They were internationally reduction by 20% in the females and 5% in males. So even if you are having quadrivalent, okay, for males it is enough, but for females, if you are having 9-valent, it will be better. Now, how much efficacy of this virus? Now, there are different researches. This was published in the 2014. And for example, in the cervical precancer, the efficacy was more than 93%. Vaginal vulval precancer lesions, the efficacy was nearly 100%. Anal precancer in males, 75%. And anogenital warts, as we said, it is very effective regarding warts. It was 98-99%. This research was published recently, and it was talking about the risk reduction. How much reduction of the cancers related to the 5 strains, which were added to the 9-valent. As we said before, the 9-valent, they introduced the 31, 33, 45, 52, 58. And once these introduced, they were studying these strains, how much reduction in the cancer related to them. They found that high-grade cervical, vulval, or vaginal disease, there was a reduction by 96%. And this was the same for the cervical intraepithelial neoplasia and adenocarcinoma. And they found also that the persistent infection also decreased by the same, 96%. Now, this is very recent meta-analysis. It was in the 2019, and it was conducted in 14 countries, and it was targeting 60 million vaccinated human, and they found that the 16 and 18 strains, there was a reduction in the cancer related to them by 83% below the age of 20 and 66% above the age of 20. And you will notice the same in the next slides, that the efficacy of the vaccine is more in the younger ages. This is why it was introduced at the start around 12 years of age. Then they said 11 years of age. Now they are saying that you can give it at the age of 9 years. So the younger, the more effective, the younger you can use 2 doses. If you are using it above 15, you need 3 doses. Now the next about anogenital warts. Again, below the age of 20, 67%, above the age of 20, 54%. And again, precancerous lesions below the age of 20, 51%, and above the age of 20, 31%. Now, is it safe? Now, this research is by CDC, and they are talking about 120 million doses were given in the United States, and they identified these side effects: syncope, side pain, fever, and anaphylaxis. And if you can notice, these side effects are related not only to the human papillomavirus. These are the side effects for any vaccine. So in general, there are no identified side effects for the human papillomavirus vaccine other than the injection of, or the side effects of the injection. Now, as an impact, if you can notice the countries, this is a timeline when the vaccine was introduced in different countries. In summary, that it is nearly in North and South America, nearly in all Europe. As we said before, in UAE, it was available from 2008, and it became in the schools in the 2018. This is also a research from Australia talking about the reduction in warts in the women less than 20 years of age, and the reduction was significant from 18% to 1%. This is the same in Australia, and the graphs talking about females and males, and the different colors of the graph are giving different age population. The green line is less than 21, and the dotted red between 21 and 30, the dotted green more than 30. If you notice in the 2007, when they introduced the vaccine, there is a drop in all age groups in the warts related to the human papillomavirus. The same, but this one is an aim from the CDC. They are, I will give you a link for a site about the information for the human papillomavirus vaccine at the end. But if you read about it, you will notice that the CDC, they are trying their best to increase the introduction of the vaccine all over America. And they are talking about if they succeeded to raise the vaccination from 30% to 80%, they can prevent around 53,000 cases from cervical cancer. The same in the genital wart. And this is cost effectiveness. Now, we said at the start that there are different screening protocols for the cervical cancer. And these screening programs are implemented nearly all over the world. We are having it here in UAE, but for those who are expert in them, they know that they are somewhat costly. So in America, the cost for the cervical cancer screening is around 6.6 billion. If you add to them the cases who are discovered to have cancers or anogenital oropharyngeal cancers, anogenital warts, those cases as all will cost around 8 billion. So introduction of the vaccine will save this amount of money, and this money can be used in another health prevention issues or in other disease management and prevention. Now, this is the site. You can go to it. It is human papillomavirus vaccine resources for healthcare professionals. Okay, this is linked to the CDC, and you can find a lot of information about this vaccine. And I think by this, I concluded my presentation, and I'm ready for questions.
Thank you, Dr. Samer. Actually, I apologize for being late. Thank you very much. It was really nice. I apologize from you and from my dear colleague Yasser Nakhlari, and we say happy birthday to him because yesterday it was his birthday. Anyway, I do apologize from all the attendees and colleagues for being late. I had some technical problem and some net problem. Actually, I was very, very delighted to hear those details about human papillomavirus because sometimes maybe we underestimate it, and as you see, as you stated before, it is more important than measles vaccine. We can go to questions and answers, and maybe you can open from your side.
Yeah, I am opening it.
Dr. Samer.
Okay.
Yes. We can choose a few of the questions. I think there are bulk of questions. I don't know. Maybe you can share your email later on for those of the colleagues.
So I think I can answer by typing.
Yes.
At the same time, I can share my emails for those questions. I will try to answer a couple of questions. What's your view on offering?
First of all, what's your view of on offering human papilloma vaccination to boys as it's common in Europe?
I think in Europe and America and Australia, they are giving the vaccine for both males and females. Here in UAE, most of the hospitals are giving it for females because it was introduced by the government in the schools for females. But international, it is offered for both. I think within a short time, it will be introduced for both.
Yes.
I think this also links to another question. Is it in the national program or not? It is not yet in the national program, but it is in the program for school vaccination. I think within a few years, it will be in the national program.
What is the age limit of human papillomavirus vaccine? Can it be administered those above 30 years of age?
It is recommended till the age of 26. So between 9 and 26.
Yes.